So we need to be more authentic with each other.
Whole life, physically, mentally, and spiritually.
Christ, Jesus, the great physician. And he was healed, and now
It's really time to reconnect with your family.
All about life, health, and healing hope. Hello, everyone. Whoever you are and wherever you happen to be watching, welcome to our show, Healing Hope. Jeannie, we've been talking a lot about doctors and hospitals and medicines, but nurses are a very important part of our lives, aren't they?
absolutely.
I remember when I had my first encounter with surgery in my adult years, cancer, melanoma, 4th level.
I remember them wheeling you down toward the operating doors, those big double doors, and how frightening that was.
You had just said goodbye to me and waved at me, and my dad and mom were there too. And then out of nowhere, 2 angels appeared, 2 nurses.
2 nurses.
And they recognized me, and they asked before I went into that room if they could just pause, and they bent over my bed, and I'll never forget that. They prayed for me.
And I remember watching that from afar, from way down the other end of the hall. And during surgery, halfway through your surgery, one of those Christian nurses came out to the waiting room where I was sitting.
Oh, is that right?
That's right. And she was so precious. She came up and gave me a hug and assured me that the surgery was going well right away. And then she asked if she could pray for me.
Wow.
Tears just welled up because there was so much uncertainty as to knowing the outcome of your surgery. And she really touched my heart. She was definitely that healing hope.
Mm-hmm.
You know, nurses really have a big impact on health care. And today our viewers are in for a real treat. Lonnie spoke recently with Sherry Rebar about nursing, whole person care, and how having a solid faith is of help to nurses and patients alike.
Thank you so much, Sherry, for being with us here on Healing Hope.
Thank you. It's a pleasure to be here.
Now, just a moment ago, before we went on the camera, you were busy texting to 300 students and 60 faculty members. What is your role at Kettering College of Medical Arts?
I'm the Associate Director of the Division of Nursing at Kettering College, and that means that I also chair the Associate Degree program right now.
What's unique particularly about nursing?
Well, I believe that what's most unique about nursing is it embodies the healing hope that we're talking about here on the show today. The difference in nursing is that we are the people that are with the patients at the most critical times of their lives, from the very beginning to the very end, and being able to stand beside them in some of the most challenging things that they will ever face.
What attracted you to this whole profession of nursing?
I chose nursing because I had a calling to help people. I couldn't explain at the time, because I was much younger, where that calling came from. I knew it was something God had laid on my heart. I didn't know where He wanted me, but I knew someplace it was involved in healthcare in the field of nursing. So I went into a program at Kettering College and was able to graduate. I was in the evening class.
You're a Kettering grad.
I am a Kettering grad, and
You're
very
part
proud
of this
it.
program.
Yes, I am. And on a side note, it's very humbling to come back and be able to work in the role that I'm in, coming from the program that I graduated from as a student.
What would have been that unique difference that you found at Kettering?
I think the unique difference that I found was that the faculty members were there for us to help nurture us to grow as professionals. Not that you can't find that in other institutions, but there was a growth that took place at Kettering College that went beyond just growth as a professional nurse. It also was growth that was spiritual.
What do you try to impart to your students in terms of this concept of whole person care?
We look at 5 different domains of the person. We look at physiological,
Okay.
and that's the physical body. We look at psychological or emotional.
They're related, of course.
Correct. We look at sociocultural, which is the environment where they live. We look at developmental levels, and we also look at the spiritual. And the spiritual is the crux of that whole person. Anytime that you have something that is afflicting somebody from the inside out, which is the spiritual being, it's going to have an impact on them. And nurses are specifically trained to be able to pick up on that type of element, and not necessarily to fix everything that happens to be wrong with somebody, but to be able to meet that need or to give referrals to somebody that can help them.
Now, does it mean something special for you, though, to be working at a faith-based medical college as opposed to, say, out there somewhere in a secular environment.
Absolutely. I can't imagine working anyplace else or teaching in any other way than grounded in faith-based nursing. I think it is so important that our students understand that even though the profession of nursing respects the spirit, it's different when you take that from a faith-based perspective, because at that point we are looking at our Creator and we're a ministry to our patients, and we give back to them in the way that He gave freely to us.
Is this a little bit of a surprise to the students, and are they kind of pleased to discover this new dimension that maybe they'd never thought of? They were going to learn the sciences and the lab work, but now there's actually the healing hope that they can provide as a nurse.
Absolutely. I think when our students come to us, obviously they know that we are a Christian institution, but not every student that comes to us has a spiritual background that they claim. Some of them come searching. Some of them come simply for the arts and sciences that you mentioned, to be able to get a profession, but I don't think anybody leaves us unchanged. They are able to find something there, whether they subscribe to that or whether they just come to respect that. But I have seen so many people whose lives have been dramatically changed by being able to be part of that faith-based institution through going to clinicals over at the hospital and also being in our classroom setting.
I hope our listeners heard that you've actually seen people whose lives are changed simply because there was a spiritual dimension.
Absolutely. I have one particular student who came to us quite broken. A very traumatic experience had happened in this individual's life, but she also knew that she wanted to be a nurse, and during the time that things were so difficult for her, she had made application to the program. She never did let her studies down, but I think that by coming to our classes and seeing that she had instructors that cared, that prayed, and that really meant what they said when they talked about God and the healing that can come from that, I saw her change so dramatically over the 2.5 years she spent with us. And by the time that she graduated, she had found her peace in God that she was lacking so profoundly when she came.
So in a very real way, you're nursing nurses.
Yes, we are. We like to think of it as growing baby nurses. And the reason I say that is because all of us that went into the nursing profession were at one time a baby nurse. And we needed somebody to show us that way and to be able to pave the path for us. And I count it a great privilege, as I know our other faculty members do, to be preparing the baby nurses of tomorrow that will go out and become the ones to train the next generation.
What are your hopes for your students as you continue to teach in the classroom?
I have so many hopes for my students. I hope that their aspirations to achieve their degree and to work in the field that they have chosen come true. And I hope someday, somewhere, that every one of my students could look back to a class or to a particular day or to a clinical experience that they had that we shared together, and that they would be able to say that I was able to plant a seed that they could take with them into professional practice.
Beautiful. Are there ever any times when you use the great physician himself, the 7 healing miracles of Jesus, for example, and his technique with reaching out and touching the leper and the woman with the flow of blood and so forth, do those become important teaching, something that kids can hang their practice as nurses on?
Yes, definitely, because I believe that Jesus was all about the touch and the healing. And our nurses are trained to be able to understand when people need that same type of touch. Sometimes it's not a physical touch, sometimes it's that touch of the heart, and other times it's as simple as knowing that they need to be there for their patient and perhaps just lay a hand on them to let them know that they are there and that they care for them.
And that's a spiritual story, of course, that I feel a sermon coming on. Jesus didn't do anything. He reached out and touched that leper, and the whole world changed.
That's absolutely correct.
We'll have more with Lonnie Melashenko and Sherry Rebar after this brief break.
Over a century ago, a brilliant young Dayton inventor had a vision for the future.
By itself! You know, this Kettering guy just might change the world.
Today, that same spirit lives on at the Kettering Medical Center Network, bringing the best in medical technology from around the world home to Dayton. With that kind of vision for the future, what might tomorrow bring?
Those guys just might change the world.
You can only imagine. The Kettering Network, for life.
If I'm going to be a healthcare provider and if people are going to come to me and trust me, then I want to give them the best care that I possibly can.
I love it. It's great. The classroom sizes are awesome. You get that personal one-on-one time, even in class.
They taught well, and I learned well, and they really, truly cared.
The philosophy of Kettering College of Medical Arts is such that our view of who we are as people means that when we care for others, we are doing the work of God. We are God's hands.
It was just so surreal to me because I didn't ever think I had a heart problem. You know, here I was 47 and they said that, you know, I probably had about a 1% chance of making it. And I did. Kettering is known as the heart hospital, and when I see Kettering, I think that's where I got my second chance, and it feels like home.
For more of the story, go to experiencekettering.com. Kettering for life.
I knew it was serious the whole time, but it was still just unreal, and you never really soaked it in. So I was hearing all this stuff, and it sounded really bad. You can't even tell that she went through such a crisis because she's back to normal. They said she'll eventually feel better than she did before. So I don't think they realized that they not only saved my mom, but it helped save my family.
For more of the story, go to experiencekettering.com. Kettering for life.
Welcome back to Healing Hope. Now we rejoin Lonnie Melashenko and Sherry Rebar as they discuss nursing and whole person care.
So it's the nurse that kind of identifies the patient's non-medical needs. Does she then sort of act as a social worker for that patient?
In essence, I look at the nurse as the vector of that information. All of the assessment information that's taken in by the nurse is then channeled. The nurse doesn't necessarily fix everything that happens to be wrong with the patient, but the nurse is able to see where the needs exist and be able to put that patient in touch with the right people. So for instance, a social worker might be someone that could help somebody with sociocultural issues. They might have financial needs. They might not be able to perform or to afford medication. And that would be where the nurse would vector that information to a social worker.
Because they can kind of measure there's stress here. There are some factors that are behind the scenes that are even beyond and maybe even greater than the diagnosis.
Definitely. And knowing that those are factors that bother the patient, it can impede healing.
Now, Kettering College of Medical Arts, where you are the Associate Director of the Division of Nursing.
Yes.
You teach these students. It's part of a faith-based hospital network, the Kettering Health Network. Does that Christian basis affect the way you teach, Sherry?
It does. It was so important for me when I chose to become a nurse educator to be able to live my Christian background and to be able to exhibit my belief system in the classroom. I count it a privilege every day to be able to open our classrooms and our clinicals with prayer, with a devotion, with a time of reflection for how that what we are going to do today is going to prepare us to take care of God's children.
How does that register with the students? Does that help them kind of relax that, oh man, I was worried about the test today, but suddenly there's a little different ambiance to the classroom?
I definitely think it does. I know jokingly we always say as long as there are tests, there will be prayer in school, but we take that one step further. And we really do pray for our students. We pray over them before they take tests or quizzes or when they're going out on the clinical floor. And again, regardless of the background that the student comes from, I do believe that they feel that difference and they know that we are invested in their growth and that we truly believe that calling on God is going to be able to protect them and to guide them and to make them in a position that they're able to make a difference for patients.
So a nurse's faith can positively impact the way he or she treats a patient. And how would that be?
Certainly, any time that you are in a frame of mind, it's going to affect how you relate to other people. It is so important that the nurse is able to project a non-biased image, an accepting type of demeanor, and a calming one, so that when they're working with patients who are stressed already, they bring an air of calm and peace and quiet to that environment. And that they also bring the advocacy for that patient into the room. In other words, the nurse is there to act on behalf of the patient. The nurse, as I mentioned before, is a vector who goes between the physician and the patient, social work and the patient, spiritual leaders and the patient, and many other types of different services. The nurse needs to be the one at the bedside that the patient is able to trust and to know that they are going to act on their behalf and do the very best that they can for them to get the care they need, whatever dimension that care needs to lie within.
Of course, the nursing care is all about the patient. But how does faith as a Christian help the nurse to cope with her own stresses and problems?
I think being able to turn to that well at the end of the day is so important for the nurse. Because as a nurse, we give. That's what we do. We stand by the bedside, again, when people are in the best times of their lives or in the worst times of their lives, and we give to them all day long. That might be an 8-hour shift, that might be a 12-hour shift, it might be days back to back that we work those same hours, but it's all about giving.
Well, what are some of the toughest challenges that a nurse will face on a daily basis?
I think some of the toughest challenges are watching people in situations that you cannot control. Most nurses that I know like to fix things, but we have to recognize we can't fix all of them. We can simply minister to them. We can try to get resources to help people. And again, back to giving. We can give of ourselves, we can give time, we can give compassion, we can give concern. And that again brings us back to that concept of healing hope.
So let me get a little bit more personal here, Sherry.
Okay.
Tell me a little bit about your own personal spiritual journey as a Christian.
Wow. I was raised in a Christian home, and I think for many years I underwent that transformation of having to move from thinking that because I was born into something that I was okay, into making a cognizant choice. When I was 16 years old, I gave my life to Christ. And at that time, I recognized that I had to personally own that ability to call Him into my life and to say that I believe that what He has to offer is what I want. From that point forward, I have searched in different places of where that I felt that I was called to. And over the years, I've been a lot of different things. I have gone to many different churches and always have found the Word of God in some way, but never found a home that I just felt really called into, that I could be part of that body of believers of Christ and be able to be part of that family to give and take from each other, to support those in need and those that would be there to support me. When we moved back to Dayton in 2005, we searched again for a church home, and after about 4 years, we finally decided that we were going to visit what we call the church across the street from our health network.
From the college where you teach.
Exactly. I don't know why it took that long to determine that maybe we should go over there and visit that. Understanding that the Seventh-day Adventist system was a Christian belief system, I didn't know as much about the history as I would like to. So when we decided to visit, my husband and I looked into a lot of different resources to learn about it. And amazingly enough, God touched our hearts and just seemed to speak those words that this is what we'd been looking for all along. So one Saturday, went to church, my daughter and I, my husband was on call, and both of us came home and said to him, this is where we need to be. The next Sabbath, he came with us, and the rest is history. And we have found in the short months that we have been there, that family that we've sought for years. And it's such a peace and such a calm to be able to go and worship with a body of like-minded believers.
Welcome to the family.
Thank you.
Sherry Rebar, thank you so much in your busy, busy schedule for joining us here today on Healing Hope.
It's been a pleasure. Thank you.
We'll have more Healing Hope after this brief break.
They actually do care about your progress. I know, when I heard that I said, yeah, okay, you know, you hear that from a lot of schools. No, really, we do care about your success.
When I go home, I talk about Kettering because I've had such a great experience here.
If you have a commitment to going into healthcare, you're going to get there in a setting where you know your fellow students and where you know your teachers, and it's going to make you someone who I think is going to be really highly valued in the workplace.
Never again just take anything, the perfect pregnancy, for granted, because you just never know. We were 4 weeks to the day early. I immediately was just like, we can't do this. We're not ready, you know, he's not ready. The special attention there was from the get-go. And so I knew he was going to be in good hands because it was their child, in the sense that the comfort was just there.
For more of the story, go to experiencekettering.com.
He smiles all the time. He's just, you know, thriving. Loves his mommy and daddy.
It was just so surreal to me because I didn't ever think I had a heart problem. You know, here I was 47 and they said that, you know, I probably had about a 1% chance of making it. And I did. Kettering is known as the heart hospital, and when I see Kettering, I think that's where I got my second chance, and it feels like home.
For more of the story, go to experiencekettering.com. Kettering, for life.
I knew it was serious the whole time, but it was still just unreal, and you never really soaked it in. So I was hearing all this stuff, and it sounded really bad. You can't even tell that she went through such a crisis because she's back to normal, and they said she'll eventually feel better than she did before. So I don't think they realized that they not only saved my mom, but it helped save my family.
For more of the story, go to experiencekettering.com. Kettering, for life.
Doctor, first it started in my nose, and I've just gone through a whole box of Kleenexes, and then I got this sinus headache, and now I've got this cough. It's like this dry cough, but I really think I need an antibiotic, and I don't feel like going to work. I'm not the only physician who's heard this refrain from a patient who feels that getting better must involve taking some kind of pill. You haven't really had a fever, you probably have a virus. That's what the physician tells the patient. But the patient keeps saying, I really need this antibiotic. So eventually the physician gives in and writes a prescription and says, goodbye, call me if you're not better. Well, how much good does that antibiotic do? Zip, zero. But everybody takes antibiotics, including babies. So how much harm can they really do? The answer is a lot more than you probably want to know. Let's start with a review of the possible side effects. They can range from something as mundane as an itchy rash from amoxicillin to life-threatening complications or even death. For example, if you have an undiagnosed allergy to penicillin, you can have severe swelling that starts with your lips, extends to your tongue, and finally rapidly, completely closes your airway in minutes. Every antibiotic can also interact with your other pills. If you're taking a blood thinner like warfarin, the levels in your blood can get dangerously high and you won't even know it till you start bleeding. Another serious potential risk of antibiotics is development of resistance. This is fairly common in women who have had frequent urinary tract infections. After 3 or so rounds of antibiotics over a year's time, the bacteria just stop responding to the antibiotic. This has led to the emergence of superbug epidemics in this country, of staph infections, and in the entire world of TB. Today we're going to focus on a bacteria that can lead to very serious complications. It's called Clostridium difficile, or C. diff for short. Since its initial discovery in the 1970s, studies have shown that mutations in C. diff have resulted in a bug that now produces 20 times the toxin it used to. C. diff becomes a problem when an antibiotic kills not only the bad bacteria, but also the good bacteria that lives in all of our intestines. This good bacteria normally keeps C. diff at bay. At one time, C. diff was mainly a concern for older people, but now serious complications from the disease are showing up in pregnant women, children, and even healthy adults. C. diff can lead to severe diarrhea that requires intensive IV therapy because of dehydration, ruptured bowel, kidney failure, severe blood infection that leads to total body shutdown, and even death. I'd like to share a story of a healthy middle-aged nurse that I know who took a 5-day course of antibiotics for a simple respiratory infection, and she ended up getting toxic shutdown of her entire colon from C. diff that required her colon to be removed and a long hospitalization in the intensive care unit. Interestingly enough, she had also gone for an interview at a nursing home at the same time she was taking the antibiotics. So she had 2 potential reasons for getting the C. diff. People who work in facilities caring for the elderly are also more at risk for C. diff. If caught early, there are effective treatments for C. diff toxin. Ironically, it involves treatment with another antibiotic, metronidazole or vancomycin. A recent study also shows that yogurt with probiotics or probiotic supplements are also effective. For serious cases that don't respond to any of these treatments we've talked about, I want to tell you about a novel treatment that can be rapidly curative. You may be shocked at this, but you can have a donation of normal stool from a non-infected person, preferably a loved one that you know well. A fair number of people have C. diff living in their colon all the time without any problem, and that includes you out there and me. So I'm going to tell you how to lower your risks of getting the C. diff toxin. First of all, physicians are really trying to prescribe antibiotics only to patients who truly need them. Those who have a bacterial infection, not just a simple cold or flu. So if your doctor is one that prescribes antibiotics for everyone in your family at the drop of a hat, please take the initiative to ask him or her if you really need them. Are you taking an acid blocker? Studies have shown that pills that suppress the gastric acid production lead to increased growth of C. diff. So you need to weigh the risks and benefits of taking your pill with your doctor. If a family member has C. diff, you need to be sure and wash your hands with soap and water. Hand sanitizers will not kill C. diff. How do you know if you have a simple antibiotic diarrhea or C. diff toxin? Well, if the diarrhea is mild and responds to plain yogurt, you're probably just fine. But if you have a high fever, very foul-smelling loose stools multiple times a day, and just feel really sick all over, you must go see your physician as soon as possible. For Healing Hope, I'm Dr. Becky Wong.
My role as Vice President of Spiritual Services and Missions at Kettering Health Network means that I'm pastor to over 10,000 employees, physicians, and volunteers. Well, what does this translate to in practical terms? Like many of you, I often encounter interruptions in my busy life. Working with physicians, nurses, patients, and families, it means my days are a continual stream of unexpected interruptions. When I get busy and overwhelmed, I reflect on the special moments that come when I've paused at the bedside of a child of God in the intensive care unit, or prayed with a dying patient, or sat with a worried family and experienced with them the relief that comes when the surgeon says, "Everything's taken care of, your loved one is going to be fine." Author Henry Nouwen said it this way, "Interruptions are my work," a terrific mantra for Christians. So the next time someone else's needs interrupt the flow of your day, stop. Instead of thinking, "Oh no, another thing to do," look for the chance to be a blessing. It's a wonder to see the power of the gospel expressed in so many ways each day, and to know that seemingly small moments we take to reach out and touch others can have such eternal significance. Thanks for joining us today on Healing Hope. For Kettering Health Network, I'm Lonnie Melashenko.